somebody comes in to be considered for knee replacement surgery, one of my first considerations is to check their age and then whether they're a more suitable candidate for a partial knee or a total knee. When you consider all the joint replacement surgeries for an arthritic knee, about 1 out of 3 are good candidates for the partial knee, and about 2 out of 3 are better candidates for the total knee. They both have advantages and disadvantages. Partial knee is 1/3 as much surgery, so that's the obvious big advantage of a partial knee. But then you've got to qualify for having one compartment worn out as opposed to both inside and outside compartments. With total knees, the majority of total knees put in are fixed bearing, and by that I mean the plastic is rigidly fixed to the tibia. And when the femur glides over it with knee motion, there's shear stress of that shiny metal against the plastic. So over time, or with heavy people, too much weight, or ambulatory deformities, that plastic starts wearing, especially on highly active individuals. And then you get particulate debris from the plastic in the joint, and that's not a good combination. The English version of their partial knee is a mobile bearing. So instead of the plastic being rigidly fixed, it actually is mobile and moves with flexion extension because the metal tray that the polyethylene rests on is highly polished, and the plastic moves over it and slips back and forth, creating much less shear stress and much less polyethylene wear. When you injure the knee, many times either the inside or the outside compartment will take the hit and have the cartilage damage. So what happens is when you have one side of the knee have cartilage damage, the total cartilage cushion becomes narrow from the cartilage damage or the cartilage loss. And when that happens, the knee tends to tip more towards the side because the cushion on that side is now narrow and the bones become closer together on that side. The longer model shows if you tip, you get the bow leg that the cowboys get. And then if the outside compartment gets damaged, or if you have a genetic predisposition to having a knock knee, then as the knee knocks and comes inward, this would be a right knee, as it comes inward, then you wear out the outer part of the knee. And when that happens, the inside of the knee is relatively spared. There's no cartilage wear there with all your activities because you're knocked, kneed, and wearing out the outside. So in those cases, you could have a partial knee to the outside for a knock knee or a partial knee to the inside if you've got a bow leg. When one compartment is worn out, it works very effectively, and the recovery rate is much quicker because you're only doing 1/3 as much surgery. So it gets people back into the workforce sooner. And many times the surgery is less, and they don't even require formal physical therapy. And if they do require formal physical therapy, it's not near as lengthy as recovery from a total knee.